health situation in Haditha city, the hospital in Haditha, in November, the American raid that hospital. I mean, this is one of the times that the American raid that hospital. So they do it regularly. The American can enter that hospital anytime that they want, with their weapons, of course. And this is again against Geneva Convention to let armed people into hospital, whoever these people are. So they raid that hospital, they fire it, they were destroyed everything, and they were beating the general director of Haditha Hospital. His name is Dr. Walid Al-Hadithi. And they've been arrested him, and they've been accusing him that he's supporting logically the terrorists or the insurgent or whatever that they call them. And he told them, he said, I should help and give the medical treatment for any person that I've seen who in need for that, whatever that he's Iraqi, he's insurgent or an American soldier or any person. So doctors were arrested. Patients who were inside the operation room have been arrested as well.
I think that Iraq in many ways is a showcase for the failure of a large number of international policies. And we go back in that sense to the very first war, which was between Iraq and Iran. And most nations that were producing weapons and selling weapons and making a major trade out of weapons benefited immensely from 8 years of war between Iran and Iraq. And there were all kinds of political agendas hidden in there, whether it was Iraq that was the friendly, secular nation defending our interests against the Islamic Revolution of Iran at that time, or whether it was Iraq that was providing oil for most major Western nations and was given preferential treatment. And a blind eye was turned throughout to any human rights violations that might have been, that were actually going on in Iraq at that time. Young Iraqis were sent to the front for years and years and years. A whole generation lost perspective for the future. Young women were kept home waiting for would-be husbands that were on the front lines for many years, and there were a very high number of people who were killed and a very high number of people who were taken prisoners of war between both sides. But the number of Iraqis taken as prisoners of war by the Iranians was much higher. Both countries at that time did not agree to go by the Geneva Conventions, which would have meant that they were to repatriate all prisoners as soon as possible after the end of active hostilities. What happened is that the Iranian government proposed to exchange one prisoner against one prisoner. Of course, the result was that a large number of Iraqis were left back in Iran, and it went on for many, many years. I'm telling you this as a flashback because it had an implication even in the last war in 2003. Because throughout the years, and I will go back to the medical situation in the time of these economic sanctions, because this is also one international failure, and I will give details about that. But on the eve of the war, in March 2003, the Iranian government declared that they were going to repatriate the last remnant of Iraqi prisoners. In March 2003, I remember being at that border, and we were there talking to these Iraqis and welcoming them back. We had never been able to visit them because the Iranian government did not give permission to the ICRC to register them and to visit them throughout these years. Many of them had been in detention for over 20 years. If you are in detention, you age very quickly. People who have been in detention for over 20 years without much possibility for exercise, when they were coming back, we were registering them at the border, and they were giving you the age. They were young soldiers who had been going out to war, and they were detained for over 20 years, and they looked like elderly people. They had not had a life at all, and we were there, and we were telling them, well, you have to board those buses and get back to Baghdad and try and get home as soon as possible, because there will be war tonight. This story was never reported. When we were putting out reports, we published a report that was called A Decade of Sanctions. And we were accused of being supporting the regime as opposed to quoting facts, saying that, yes, there were hundreds of thousands of Iraqi babies who didn't make it to grow up just because there was no medical facilities available or operating properly in those years. But when you were saying that, you were practically accused of politicizing the issue or of supporting the regime against the sanctions. If we want to give a little bit of details about what was going on during the sanctions, it's obvious that we were trying to express concern at that time, and that it was very clear that it was impossible for humanitarian organizations such as the Red Cross, and the International Committee of the Red Cross was the only international agency allowed to operate in Iraq at that time, under a lot of constraints from the government, but nevertheless we were able to be there. We were negotiating exemptions from the regime of economic sanctions, because the sanctions meant that you actually practically couldn't import anything in Iraq. Even pencils were prohibited because it contained whatever chemicals that could have been used for something else. So it was practically impossible to get things organized. So the ICRC was negotiating exemption lists to obtain the chemicals that are needed to operate the water purification stations. Iraq, because it was a rich country and had access to, well, had oil and access to a lot of finance, had developed into a very modern country in the 70s. I remember in the 80s I was invited to chair a meeting of international surgeons, which had been set up by the ICRC there, looking at the experience of war surgery. And there were people from the US, from Canada, from England, from all kinds of countries who came to Baghdad, and they were all in awe at the level of technology. So for any Iraqi person now to live through what Rana was describing, that you are in a situation where getting hold of the most simple form of medical treatment has become a virtual impossibility.
Haditha Hospital today, they have 2 incubators. One of them is not working. The other one, they just get it as donation from one of the organizations.
Iraq used to have state-of-the-art. Iraq used to be giving money to international projects for the UNICEF and for all kinds of other organizations working worldwide in poor countries. And suddenly, Iraq has literally been bombed into the Middle Ages. This expression is not from me, it's been in the press, but it is true. So think of anyone our age has lived with top quality facilities. For an Iraqi mother, it's absolutely legitimate to think, I can go to hospital if I have a premature birth, there will be an incubator, the baby will live, and the baby will be fine. Now, since the sanctions, a large proportion of Iraqi babies are born weighing less than 2 kilos.